I'm Dr. Michael, and today we're going to discuss something that many of my patients over 60 are curious about, but rarely ask directly: what the color of your urine actually tells you about your health. Over my 25 years of practice, I've learned that urine color can provide valuable insights into your body's condition, but it's important to understand what changes are normal and which ones require immediate medical attention. Your urine color is determined by several factors, including your hydration level, the foods you eat, medications you take, and your overall health status. As we age, our kidneys undergo natural changes that can affect urine appearance, but certain color changes can signal underlying health conditions that need prompt evaluation. Normal urine ranges from pale yellow to amber, depending primarily on how concentrated it is. The yellow color comes from a pigment called urochrome, which is produced when your body breaks down old red blood cells. When you're well hydrated, your urine appears lighter because it's more diluted. When you're dehydrated, it becomes darker and more concentrated. However, aging affects kidney function in ways that can influence urine color and concentration. After age 40, kidney function typically declines by about 1% per year. This means that by age 70, your kidneys may be functioning at about 70% of their original capacity. This natural decline affects how well your kidneys concentrate urine and filter waste products. Understanding these age-related changes helps distinguish between normal variations and concerning symptoms. Your kidneys work harder to maintain proper fluid and waste balance as you get older, which means paying attention to urine color becomes even more important for monitoring your health. Let's start with the most concerning urine color that requires immediate medical attention: dark red or cola-colored urine. This appearance often indicates the presence of blood in significant amounts, a condition called gross hematuria. Unlike microscopic blood that can only be detected through laboratory testing, gross hematuria is visible to the naked eye and always warrants urgent evaluation. Dark red urine can result from kidney stones, urinary tract infections, kidney disease, bladder cancer, or prostate problems in men. The dark color indicates that blood has been present in the urinary system long enough to undergo chemical changes, which can suggest bleeding from the kidneys or upper urinary tract. Sometimes, vigorous exercise can cause temporary blood in urine, particularly in older adults whose blood vessels may be more fragile. However, exercise-related blood should resolve quickly and completely. If your urine appears consistently dark red or brown, especially if accompanied by pain during urination, back pain, or fever, you should seek immediate medical attention. The presence of blood clots in urine, which might appear as dark, stringy material, is particularly concerning and requires emergency evaluation. Blood clots suggest active bleeding that needs immediate medical intervention to prevent complications. The second concerning color is bright pink or red urine that appears suddenly. This can indicate fresh bleeding in the urinary tract, often from the bladder, urethra, or lower portions of the kidneys. While this might seem less alarming than dark red urine, any visible blood requires medical evaluation to determine the source and cause. Fresh blood in urine appears bright red because it hasn't been chemically altered by prolonged contact with urine or passage through the urinary system. This type of bleeding often originates from the lower urinary tract and may be accompanied by burning during urination, frequent urination, or pelvic discomfort. Pink or red urine can sometimes result from eating large amounts of beets, berries, or rhubarb, but food-related color changes typically resolve within 24 hours and don't recur unless you eat the same foods again. The key difference is that food-related changes are temporary and directly related to recent meals. If the pink or red color persists for more than a day, occurs without obvious dietary causes, or is accompanied by pain, fever, or changes in urination frequency, medical evaluation is necessary. Early evaluation of blood in urine often leads to more effective treatment of underlying conditions. The third warning color is orange urine, which can indicate several different conditions. Orange urine most commonly results from severe dehydration, but it can also signal liver problems, bile duct obstruction, or reactions to certain medications. The orange color often comes from elevated levels of bilirubin, a waste product normally processed by the liver. When liver function is compromised, or bile ducts are blocked, bilirubin can accumulate in the blood and spill into the urine, creating an orange or deep amber appearance. This is particularly concerning if accompanied by yellowing of the skin or eyes, called jaundice, dark-colored stools, or abdominal pain. These symptoms together suggest liver or gallbladder problems requiring immediate evaluation. Conditions like hepatitis, gallstones, or bile duct obstruction can cause this combination of symptoms and need prompt treatment to prevent complications. Some medications can also cause orange urine, including certain antibiotics, laxatives, and chemotherapy drugs. However, medication-related color changes should be discussed with healthcare providers to ensure they represent expected side effects rather than concerning reactions. Dark brown urine represents another serious warning sign that demands prompt medical attention. This color can indicate severe dehydration, liver disease, or a condition called rhabdomyolysis, where muscle tissue breaks down and releases proteins that can damage the kidneys. Rhabdomyolysis can occur from extreme physical exertion, certain medications, infections, or prolonged immobility. The condition is particularly dangerous for seniors because age-related changes in kidney function make it harder to clear the muscle proteins that can cause severe kidney damage. The muscle proteins released during rhabdomyolysis can overwhelm the kidney's filtering capacity, leading to acute kidney injury that may require emergency treatment, including dialysis. Early recognition and treatment significantly improve outcomes for this serious condition. Dark brown urine can also result from severe liver disease or conditions affecting the breakdown of red blood cells. Hemolysis, the destruction of red blood cells, releases hemoglobin that can darken urine and indicate serious underlying conditions. If your urine appears consistently dark brown, especially with fatigue, weakness, muscle pain, or abdominal discomfort, immediate medical evaluation is crucial. These symptoms together can indicate life-threatening conditions requiring emergency treatment. Blue or green urine, while rare, can occur and usually results from medications, food dyes, or certain medical conditions. Some medications, including amitriptyline, indomethacin, and certain anesthetics, can cause blue-green urine coloration. Certain bacterial infections, particularly those involving Pseudomonas bacteria, can also produce unusual blue-green urine colors. While these infections are uncommon, they can be serious and require specific antibiotic treatment. Artificial food coloring from medications, supplements, or foods can sometimes cause temporary blue or green urine. However, these changes should resolve quickly once the coloring agents are eliminated from your system. While blue or green urine is typically not immediately dangerous, it's unusual enough that it warrants medical discussion, especially if it persists or occurs without obvious medication or dietary causes. Healthcare providers can determine whether the color change represents a harmless side effect or requires further investigation. Cloudy or murky urine deserves special attention, particularly in seniors who are at increased risk for urinary tract infections. Cloudiness can result from white blood cells fighting infection, bacteria, protein, or other particles suspended in the urine. While occasional mild cloudiness might result from dehydration, concentrated urine, or dietary factors, persistent cloudiness often indicates infection or other urinary tract problems that require medical attention. Urinary tract infections are more common in seniors due to age-related changes in bladder function, incomplete bladder emptying, weakened immune systems, and hormonal changes. Women are at particularly high risk due to anatomical factors and estrogen deficiency after menopause. Cloudy urine, accompanied by burning during urination, frequent urination, pelvic pressure, or fever, suggests urinary tract infection requiring antibiotic treatment. Untreated urinary tract infections in seniors can progress to more serious kidney infections or bloodstream infections. Foamy or frothy urine can indicate protein in the urine, a condition called proteinuria. While small amounts of protein are normal, excessive protein can signal kidney disease, diabetes complications, or high blood pressure affecting kidney function. Normal urine contains very little protein because healthy kidneys filter out waste products while retaining proteins needed by the body. When kidney filtering mechanisms are damaged, proteins leak into the urine, creating persistent foam that doesn't dissipate quickly. Persistent foamy urine, especially if it resembles beaten egg whites or doesn't disappear after flushing, should be evaluated medically. This can be an early sign of kidney disease that benefits from prompt treatment to prevent progression. The amount and persistence of foam matters more than occasional bubbles. Normal urine may have some bubbles from the force of urination, but these typically disappear quickly. Protein-related foam tends to persist and may accumulate on the surface of the water. Understanding these concerning urine colors and characteristics helps you recognize when immediate medical attention is needed versus when changes might be less urgent. The key is knowing what represents normal variation versus significant symptoms requiring evaluation. Regular observation of your urine color and characteristics, without becoming obsessive, can provide valuable information about your health status and help with early detection of conditions that benefit from prompt treatment. Now let's discuss normal variations that shouldn't cause concern but are common questions in my practice. Very pale yellow or nearly clear urine typically indicates good hydration status. While this is generally healthy, consistently very pale urine might suggest you're drinking excessive amounts of fluids, which can sometimes indicate underlying conditions like diabetes or certain medications affecting fluid balance. Overhydration, while less common than dehydration, can dilute essential electrolytes in your blood and potentially cause problems. However, most people don't drink enough water rather than too much. So pale yellow urine is usually a positive sign of adequate hydration. Bright yellow or neon yellow urine often results from B vitamin supplements, particularly riboflavin, also known as vitamin B2. This is completely harmless and represents your body processing and eliminating excess vitamins that it doesn't need. Many multivitamins contain high doses of B vitamins that create this bright coloration. The bright yellow color typically appears within a few hours of taking vitamin supplements and gradually fades as the vitamins are processed. This is normal and doesn't indicate any health problems or need to reduce vitamin intake unless specifically advised by your healthcare provider. Dark yellow urine usually indicates mild to moderate dehydration and is particularly common in the morning when you haven't consumed fluids for several hours during sleep. This normally resolves with adequate fluid intake throughout the day and represents your body's natural concentration of urine overnight. However, if dark yellow urine persists despite adequate fluid intake, or if it's accompanied by symptoms like dizziness, fatigue, or decreased urination frequency, it may indicate more significant dehydration or other conditions requiring medical attention. As we age, our thirst sensation decreases, making it easier to become dehydrated without realizing it. Many seniors don't drink enough fluids throughout the day, either due to decreased thirst awareness or concerns about frequent urination, particularly if mobility is limited. Medications commonly prescribed to seniors can significantly affect urine color, and understanding these effects helps distinguish between concerning symptoms and expected medication side effects. Blood-thinning medications like warfarin can sometimes cause pink or red urine if they affect bleeding anywhere in the urinary system. Antibiotics, particularly those in the nitrofurantoin family used for urinary tract infections, can cause dark yellow or brown urine. Phenazopyridine, used to treat urinary pain, causes bright orange urine that's completely normal while taking the medication. Antidepressants, particularly tricyclic medications like amitriptyline, can cause blue or green urine coloration. Anti-inflammatory medications can sometimes cause darker urine colors. Iron supplements frequently cause dark or black coloration that's harmless, but can be alarming if unexpected. It's crucial to discuss any urine color changes with your healthcare provider when starting new medications. Many color changes are harmless side effects, but medical evaluation helps distinguish between expected medication effects and concerning symptoms requiring investigation. Dietary factors also significantly influence urine color, and understanding these influences can prevent unnecessary worry about temporary changes. Asparagus consumption can cause green-tinged urine along with a distinctive sulfur-like odor that some people can detect while others cannot due to genetic variations. Blackberries, beets, and rhubarb can cause pink or red coloring that's completely harmless but can be alarming if unexpected. The pigments in these foods pass through your system largely unchanged and create temporary color changes.
Carrots, sweet potatoes, and foods high in beta-carotene can cause orange-tinged urine, particularly if consumed in large amounts. Vitamin A supplements can have similar effects.
Fava beans can sometimes cause dark urine in people with glucose-6-phosphate dehydrogenase deficiency, a genetic condition more common in certain ethnic groups. Understanding these dietary influences helps you correlate urine color changes with recent meals and avoid unnecessary panic about temporary variations. However, if unusual colors persist beyond 24-48 hours after dietary causes, or if they're accompanied by other symptoms, medical evaluation may be appropriate. Hydration status significantly affects urine color and concentration throughout the day. Proper hydration typically produces pale yellow urine during most urination episodes, with some natural variation based on timing and recent fluid intake. Seniors face increased dehydration risk due to several age-related factors. Kidney function naturally declines with age, affecting the body's ability to concentrate urine and conserve water. Thirst sensation decreases, making it less likely that you'll feel thirsty even when your body needs fluids. Many medications commonly prescribed to seniors, including diuretics for blood pressure, can affect fluid balance. Some people limit fluid intake to reduce nighttime urination, inadvertently increasing dehydration risk. Physical limitations may make it harder to access fluids regularly throughout the day. Signs of dehydration include dark yellow urine, decreased urination frequency, dizziness, fatigue, dry mouth, and confusion. Chronic mild dehydration can worsen kidney function, increase risk for kidney stones and urinary tract infections, and affect overall health and energy levels. The frequency and timing of urination provide important health information beyond just color. Normal urination frequency ranges from 4 to 8 times daily, but this varies significantly based on fluid intake, medications, bladder capacity, and individual factors. Significant changes in urination patterns warrant medical discussion. Increased daytime frequency might indicate urinary tract infections, diabetes, prostate problems in men, or bladder dysfunction. Decreased frequency can suggest dehydration, kidney problems, or medications affecting kidney function. Increased nighttime urination, called nocturia, becomes more common with age, but can significantly impact sleep quality and increase falls risk. While some nighttime urination is normal, waking more than twice nightly often indicates underlying conditions that can be treated. Nocturia can result from diabetes, heart failure, sleep apnea, prostate enlargement in men, or medications taken in the evening. Treatment depends on the underlying cause, but often significantly improves quality of life and sleep. When should you seek immediate medical attention for urine changes? Contact emergency services or go to the emergency room immediately for dark red or brown urine, accompanied by severe pain, high fever, signs of severe illness, or difficulty urinating. Seek urgent medical care within 24 hours for persistent blood in urine, orange urine with yellowing skin or eyes, sudden dramatic changes in urine color without obvious cause, or any urine color changes accompanied by severe symptoms like high fever, severe pain, or inability to urinate. Schedule routine medical appointments for persistent cloudiness, foamy urine, gradual changes in urination frequency or color patterns, or any changes that concern you even if they seem minor. Early evaluation often leads to more effective treatment. Preparing for medical appointments about urine changes helps ensure productive discussions. Keep a brief record of when changes occur, their characteristics, duration, and any associated symptoms. Note timing in relation to meals, medications, or activities. Record your typical urination frequency and any changes in patterns. List all medications, including over-the-counter drugs, supplements, and herbal remedies, as many can affect urine appearance. Bring a list of recent dietary changes or foods that might influence color. Healthcare providers will typically perform urinalysis, which examines urine under a microscope and tests for blood cells, bacteria, protein, glucose, and other substances. This simple, non-invasive test provides valuable information about kidney function, infection, and various health conditions. Additional tests might include urine culture if infection is suspected, blood tests to evaluate kidney function and overall health, or imaging studies if structural problems are considered. Most urine-related concerns can be evaluated quickly and effectively with basic testing. Prevention strategies help maintain urinary health throughout aging. Stay adequately hydrated by drinking water throughout the day, but avoid excessive amounts that might dilute essential electrolytes. Monitor your urine color as a hydration guide, aiming for pale yellow most of the time. Practice good hygiene, particularly for women, by wiping front to back after using the bathroom. Empty your bladder completely during urination, and avoid holding urine for extended periods when possible. Urinate after sexual activity to help prevent infections. Managing chronic conditions like diabetes and high blood pressure helps protect kidney function and maintain healthy urine characteristics. Take prescribed medications as directed and attend regular medical checkups for monitoring and early detection of problems. Lifestyle factors supporting urinary health include maintaining a healthy weight, exercising regularly within your capabilities, limiting excessive alcohol and caffeine intake, and avoiding smoking. These factors support overall health and specifically benefit kidney and bladder function. Building awareness of your normal urination patterns helps you recognize significant changes that warrant medical attention. Pay attention to your usual frequency, typical color variations throughout the day, and any symptoms usually associated with urination. Family history influences urinary health risks. Kidney disease, diabetes, and certain genetic conditions affecting the urinary system can run in families. Understanding your family medical history helps healthcare providers assess your individual risk factors and recommend appropriate screening. Age-related changes in urinary function are normal, but don't mean concerning symptoms should be ignored. While some changes in frequency, urgency, and minor color variations are expected with aging, significant alterations deserve medical evaluation. Creating a health monitoring routine that includes casual awareness of urine characteristics can help with early detection of health problems. This doesn't mean obsessing over every minor variation, but maintaining general awareness of significant changes or patterns. The connection between urinary health and overall health means that urine changes can sometimes provide early warning signs of systemic conditions. Diabetes often first shows up as glucose in urine. Kidney disease may first appear as protein in urine. Liver problems can cause color changes before other symptoms develop. Understanding when urine changes require urgent attention versus routine medical discussion helps ensure appropriate care. Dramatic color changes, especially involving blood or brown coloration, warrant immediate evaluation. Gradual changes or minor variations can often be discussed during regular appointments. Technology increasingly offers tools for monitoring health at home, including urine test strips that can detect glucose, protein, blood, and other substances. While these can provide useful information, they should supplement rather than replace professional medical care and evaluation. Remember that urinary health is an important component of overall health and quality of life. Changes in urine characteristics can provide valuable early warning signs of conditions that benefit from prompt recognition and treatment. The key message is that while many urine color changes are harmless and temporary, certain changes require medical attention to ensure optimal health and early treatment of underlying conditions. By understanding what changes are concerning and maintaining open communication with healthcare providers, you can take proactive steps to protect your urinary and overall health. Don't let embarrassment prevent you from discussing urinary health concerns with your healthcare provider. These conversations are routine for medical professionals and can provide important insights into your health status and needs for preventive care or treatment. Your health and well-being are worth any temporary discomfort in discussing these important topics.